We'll continue this lecture. This fourth columns, every one of this one is enough to develop this massive DVT. Example, orthopedics patient. Many doctors forgot patient has a leg fracture or foramen fracture, hip fracture. Alone is 5 point. Even many patient has a stroke within 1 month. The stroke is alone is develop massive pulmonary embolism, massive DVT. Even multiple trauma, this more than 2 organ, a post RTA has a serious cases. Many doctors post RTA forgot that. Even elective major lower extremities arthroplasty, acute spinal cord injury, paralysis within the past months. Okay, every one of this one should be everyone take 5 point. Example, this patient has this 3 point plus 1, 4, 5, 6. The score is 6 here. Okay, the score is 6. Before decide to take prophylaxis, should see the contraindication first. The contraindication is easy to Clexane. A patient has active bleeding, allergy to Clexane. Patient has already taken the rivaroxaban or warfarin or enoxaparin before. Or examine MI patient, we prescribe enoxaparin full therapeutic dose. Just mean this contraindication to prophylaxis dose is taking extra treatment. Patient has high BP, blood pressure more than 185/110. Patient has epidural anesthesia within 24 hours. Patient has recent intraocular surgery or intracranial surgery. Clinical significant thrombocytopenia less than 100. This is another one. Creatine clearance less than 30. INR more than 1.8. History of gastrointestinal bleeding or hemorrhagic stroke. If we find any one of this point, we examine this patient has already taken Clexane full dose of therapeutic. This may be patient contraindication to prescribe prophylactic Clexane. In this situation, we should after that should not prescribe Clexane. What we do here, this examine, this score is 6. We have down 4 square. First square, if the score less or equal 1 point, this means patient led early emboliation. If a score is equal to 2, we should choose one, heparin or enoxaparin or CCOMS compression device. Enoxaparin dose 30 if creatine clearance is low, less than 30. Otherwise, enoxaparin is safer, 40 milligram. The first square, so the score is between 3 and 4. Here, we can choose heparin or enoxaparin with or without CCOMS compression device. The first one, if score equal or more than 5, we should choose both heparin plus CCOMS compression device or enoxaparin plus CCOMS compression device. Example, this patient has a contraindication to Clexane here. This means we choose the mechanical. It's very important. Many doctors, patient has contraindication, he not take or he take on Clexane error. Example, this is not acceptable, or forgot to take on CCOMS compression device. Many mistake. Patient example has score 6. Patient has without contraindication and just he take only on Clexane. If score equal or more than 5, should take both Clexane with CCOMS compression device. It's not acceptable to take in one. Finally, the doctor should write his name and sign. If resident sign, specialist or consultant should sign and review within 24 hours. And I should write date. Okay, date already written here. But acceptable if write, sign and signature. But if written date is better because the pen is down here. Example, this is the update form. When will update the form is very important question. If patient shifted from ward to ward, example from ward to ICU or from ICU to ward, or patient has pre-OR, post-OR, or patient has a new situation, new update in his clinical condition, we should update here. How will update? We'll write signature, date and sign. It's easy. This is a form. Another example, pre-OR, post-OR, the form should be updated. And we should write pre-OR, post-OR. Very important. Many doctor surgeon forgot that patient has updated a new form post-OR. Even medical patient Patient has a new stroke, example, new situation. We should write another form. If the score same, we'll keep just sign and signature down. Example here, I sign a signature because the score is same. But if the score change, example pre-OR, post-OR, should write another form, or write here post-OR and change the score and sign here, both. Okay, even patient minor surgery, example post-OR, new form should stick on minor surgery. This mean any patient, surgical patient, we should write two form, pre-OR, post-OR, and post-OR is a new form. The scratch in the form is not acceptable here, should be careful. Okay, this is a form of medical and surgical form. Okay, we'll go to OB/GYN, to postnatal, antenatal. Okay, antenatal, this means any patient, female patient has delivery. This even patient, the fetus is dead or not, but usually patient has normal delivery. This means the form, because look at the name, antenatal and postnatal. Antenatal, same notice before, file number, age, female, sex, and BMI here, but the form is different. We have three columns here. This first column, second column, third column. Okay, the column, this is the low risk column, intermediate risk column, high risk column. Low risk column, if the patient has three thick risk factor, this means patient will be intermediate risk here. Patient deserve Clexane. If patient has less than 3, this means too thick. This means patient low risk and she not deserve anything. Example here, to look at this patient, hospital admission more than 30 days, 3 days. This means hospital admission alone deserve this column, intermediate risk, deserve Clexane. Even has single previous VTE related to major surgery, medical comorbidities like SLE, IBD, any surgical procedure like appendectomy. Any one of this means patient intermediate risk in antenatal form and deserve Clexane. But here, high risk, I would look at low risk, obesity, more than 30, age more than 35, parity. This means how many patient, when delivered. Smoke, gross varicose vein, eclampsia, low risk thrombophilia. Okay, in high risk, any previous VTE, it's easy, it's high risk. This means patient need low molecular weight heparin. Even before take on Clexane, you should see the contraindication. The contraindication, same contraindication of last form of VTE. Active bleeding, platelets low, INR high. Okay, in this situation, we should take on Sycomosh compression device. This antenatal form, we should be careful, many mistake. If a score low risk, more than 3 tick factor, more than 3, this means intermediate, should not low risk. Here acceptable, this is 1 risk factor here. This to low risk mean no need anything. We'll go to the postnatal form. Here postnatal mode, this mean patient already deliver. Okay, the same notice before he see no file number is not acceptable. Okay, this patient we take on BMI, patient vaginal delivery, this mean not deserve anything. She don't have any risk factor, low risk here. But this patient has a serious section on labor. The column is different. Serious section labor, this means patient has a labor, then the doctor decide to do cesarean. Example, any patient has a BMI more or equal 40, this means directly intermediate or readmissions. The many doctor have mistake here. Okay, the mistake that if the patient has 2 or more score, should be intermediate, not low risk. This means one point, but the patient has cesarean section in labor. This means directly intermediate risk. This means directly she need Clexane according to the weight, if no contraindication. But I noticed why patient stick on use Sycomosh decompression device. The patient enough. She need just only Clexane. Sycomosh compression device only if patient has a contraindication to Clexane like active bleeding. Okay, this is the form of postnatal form. We'll talk about how to fill the form online. We'll go first to medical, surgical, OB form. If we open the form, this form is online. You look at the first page how to. The filling the form is easy if you understand how you fill the paper form. The first paper you're asking about hospital,